Adults age 60 and older, especially those with certain underlying conditions, should be aware of the risks of severe RSV. So Dr. Stacy Zulueta and Dr. Candace Robinson join me now to address common questions about RSV, as well as the importance of getting vaccinated. So thank you both for joining us today. Such an important topic, of course. And Dr. Robinson, let's start with you. What is RSV exactly, and how does it spread?
Yes, well, thank you for having us. RSV, or respiratory syncytial virus, is a common, contagious, and potentially serious respiratory virus. Symptoms may include runny nose, sneezing, dry coughing, headache, or fever. And RSV can spread easily when someone who's infected coughs or sneezes. It's also likely to be transmitted by touching a contaminated surface before touching the eyes, nose, or mouth. And so as Chronic Disease Awareness Month comes to a close, it's an especially great time to get informed about potential health risks, including how some chronic health conditions can put you at increased risk for severe RSV.
And Dr. Zulueta, I want to talk to you about some of the common misconceptions that we have about RSV. What can you tell us?
Yeah, one misconception that we hear a lot is about who's at risk for RSV. A lot of people have heard that RSV impacts infants and young children, but in reality, anyone can contract RSV. So actually, if you are an adult ages 50 to 74, you should talk to your doctor or pharmacist about your individual risk and about RSV vaccination, because there are certain underlying health conditions that do put people at higher risk.
Yeah, and Dr. Robinson, let's go back to you. Why are people over 60, especially adults with chronic conditions, at an increased risk for the RSV infection?
Yeah, the risk of severe RSV increases with age since the immune system typically weakens as we get older. Additionally, like Dr. Zulueta mentioned, certain chronic medical conditions can also increase the risk for severe RSV infections. So older adults with chronic heart disease, COPD, complicated diabetes, or asthma face a greater chance of falling severely ill from an RSV infection. So if you are between the ages of 50 and 74 and are at increased risk for severe disease due to a certain medical factor, or if you're 75 years of age or older, it's important to know your risk for RSV and to speak with a doctor or healthcare provider or pharmacist about RSV and about vaccination.
And Dr. Zulueta, back to you then. So why is it important that we speak proactively to our pharmacists or healthcare providers, and what types of questions should we be asking?
Yeah, so I know typically in the summertime we're all taking a break, relaxing with our family by the pool, so it feels like it's really easy to push all of these things down your to-do list. Summer is going to be over really soon, and so keep in mind that vaccination is one of the most powerful tools that we have to protect ourselves as winter is coming. So next time you're coming in to your local Walmart, even if you're just there to pick up some extra sunscreen, you can take that opportunity to talk to one of our pharmacists about your risk for RSV and about vaccination.
Is there anything specific we should be asking about, or just kind of telling them about our age and our issues, and then they kind of tell us their, I guess, suggestion?
Yeah, absolutely. You can feel free to ask your pharmacist any individual question about how to protect yourself, whether that's one of the conditions that Dr. Robinson mentioned, like diabetes or COPD, or whether it's your age. All of these things factor in together to put you at risk, and so your pharmacist is there to support you and help you really understand what level of risk you are at.
Wonderful. Well, thank you both so much for joining us. Dr. Robinson, where can we go for more information on everything?
Absolutely. You can visit easyvax.com. That's EASYVAX.com to learn more about all vaccines available near you.
Awesome. Great to see you both. Thank you so much for joining us and helping us stay safe this season and beyond. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.